I would like to see women not portrayed as victims. We are not victims. We are not broke. We are not broken. And we don't always need to be portrayed as victims.
And, you know, one of the things of my passion, I'm very passionate about really talking to women, empowering women, and really working with younger women, the youth. You know, I think that's a very important piece. We talk about STDs, we talk about HIV, you know, we talk about condom use. I don't promote sex, but if you're having sex, it is what it is. Like, you have to, like, you know, let young people know.
And I really feel low self-esteem, it does play a big part in why women contract HIV. You know, we don't say that enough, but we're not telling women, you might not love yourself enough because you're putting yourself at risk for HIV. And so we really need to start saying that and being real with our, especially our friends and the women in our family. That I think I read something on Facebook, you date at the level of your self-esteem. And so we gotta start saying it.
So there's the importance of mentorship from our sisters and our friends, I think is very important, but there's a point where I do think a lot of us need therapy, and that we have to be honest about that. We need to talk about that. We have to be okay with seeking it. As a woman, as a, you know, as a physician, I have no problem saying that I have had therapy, and it is. I feel everybody should have a therapist.
Yeah.
Everybody should.
Every year I go to my gynecologist because we go every year and we check in, and we have the conversation. She asked me, do you want to check for STDs? And I've been with this man for 5 years. Every year I say yes. And it's never not about not trusting him. It's always about loving me.
During the pregnancy, it was complicated because, as most mothers know, your body goes through a lot of changes during pregnancy. So being HIV positive on top of that, there was like an extra thing that you had to go through. And there's extra tests, and you have to make sure that you're taking your medicine, make sure that you're doing whatever you can to make sure that your child will be born healthy. Even though there's a less than 2% chance that a child will be born with HIV in the US today, there's still that less than 2% chance. So you don't want to risk it at all.
We do know that the numbers of new diagnoses of HIV is going down, and that's fantastic news. And that number, by the way, is largely due to a drop in African American women, because, as you know, black women are the most affected women in the United States with HIV. But take a closer look at those statistics, and what you see is that after women are diagnosed with HIV, they enter into medical care, they go see a doctor, they start their treatment. A couple months later, they're not in treatment anymore. They're not going to the doctor anymore, they're not taking their antiretroviral therapy anymore. Their virus is not suppressed, which means women's health is suffering. And, you know, it's this vicious cycle because women are the ones who are taking care of everybody else, and yet their own health is suffering, and so how are they taking care of everybody else? It's this constant race of trying to catch up with how do you look after yourself, how do you make yourself a priority, make sure that you get yourself taken care of, because it's kind of where the center of the whole family and the whole system is revolving around. And I'm appalled that in 2015, in the United States, we still don't have that worked out.